Are you suffering from some issues, your lower back, and it's shooting all the way down to your leg? Well, it may be more than just nerves, and that's why we come and see this young lady, Dr. Sonia Spencer. How are you? It's always a pleasure.
I love it when you call me a young lady.
Well, you are.
I know, I'm young at heart.
That's why you look so great.
Thank
and
you.
that's that's one of the things that more and more people, if they felt more young at heart, maybe they wouldn't have the health issues that they do.
I know, and when you're hurting and you don't feel good, it kind of makes you feel old.
It does.
And sometimes when people come in, they say, "Oh, I'm just feeling old and decrepit," and they're not really that old. Just the pain has kind of worn them down. And so our mission at Spencer Chiropractic is really to help people feel young and feel good again, so they can get back to enjoying life and the things they love to do.
And there's so many issues that that go throughout the body that we've seen with you and talked about so many times that one thing can lead to another, and if you don't get it treated right, you could really get into some serious problems.
That's right. And so many people come in. One of the most frequent reasons why people come in to see us is lower back and leg pain, pain in the butt, pain in the lower back, pain going down the legs. So we always start with an examination. An examination is crucial to find out really what's causing the issue, because so many times people go in and get an MRI.
Right.
Their doctor orders an MRI, but they never actually have a physical examination with someone touching them. Someone touching them, someone touching their spine, someone touching the soft tissue, someone doing some orthopedic and neurological testing on them. And they're just amazed when they actually have an exam at our office and say, wow, nobody's ever even touched me the way.
Because you use your hands,
right.
And you can feel and see how does it. That bothers me right there.
That bothers me. Yes.
That's and that's a good starting point.
Right. And so the MRI is good information, but it has to be correlated clinically to what is going on with you as a person. Most of us right now have positive MRI findings. If you were to take 100 people who don't even have lower back pain and put them in an MRI, something would show up on an MRI.
Right.
So you can't just say, well, I'm going to go in and surgically fix all the things that I find wrong on an MRI without correlating it to a person. So it has to be correlated with a physical examination to see exactly what's wrong with that person. And that's where we begin with the history, the examination, and finding out what's wrong with the person and seeing what we can do to fix it. Because we have so many different ways that we can help a person get better here at Spencer Chiropractic. So let's talk about how the pain travels.
Push the button. I never get to push the button.
You're going to push the button today?
I'm gonna push the button.
All right. So these are the nerves that come out of the lower back. You can see the hips right here, and the buttocks. Lower back and buttocks can affect either leg. Most people who come in have lower back and leg pain on one side.
Right.
And one of the most frequent questions is, well, why does it hurt more on one side? And the reason is because they may have disc pressure or pelvic rotation or a misalignment putting pressure on a specific nerve at coming out.
Is that where that sciatica nerve is?
It can be. Yeah, the sciatic nerve is formed from nerves that come out of the back. You can see it right here. This is the largest nerve in the body.
Wow.
Right here. It's a very big nerve, and it's very, very painful. So it's formed out of the nerves that come out of the lower back. They all get together right there in the butt, and then it joins and it comes down. Now, in a small percent of the population, it actually goes through a group of muscles that come out and go into the buttock. So sometimes people have some tightening of that muscle, and it can squeeze the sciatic nerve and cause pain down the leg. Sometimes there's some disc problems. I'll let you let go of that right now because I know your little finger gets tired. Sometimes they can have some disc problems. So that's what I want to talk to you a little bit about today.
Okay.
I hope you can see this good on TV, because this is a bulging disc right here. The disc is actually made up of protein and water, okay? So, and there's pain fibers in the outer portion of this disc.
Right.
So if a disc gets inflamed, it can actually be a source of pain for people without it even bulging out. When it bulges bulges out, though, it can put pressure on the nerves. And those nerves, go ahead and push that button again, Jim.
Okay.
I know you want to, can affect anything along this pain path right here.
What gets me is, these nerves, how big they are.
They're big and huge. And they go to every muscle in the leg. So they go everywhere. They can affect any part of that leg.
Mm-hmm.
Some go all the way down to the feet.
Right.
So anyway, when someone has a bulging disc right here, it can put pressure on the nerve. That's just why the MRI is good information and can give us some ideas about what's going on with a person. And a good % of disc problems respond well to chiropractic care. However, if they don't, we have another therapy that we can do called decompression, where we actually place a person on a machine. After we make sure that they're a good candidate, they have to go through a series of
tests
to make sure that they're a good candidate. Thank you. You always fill in my words for me. I have to go through.
We've done this together for so many years.
Yes. Have to go through a series of tests to make sure they're a good candidate. But the machine actually will exert a gentle decompression here, and the disc will undergo a negative force, and the material will actually come back into the disc and begin to heal.
Wow.
So those pain-generating elements that are occurring in the disc will begin to heal, which is fantastic because this helps some people avoid drugs and surgery, which is so fantastic. So we can do decompression on a patient. We can do chiropractic adjustments on a patient. We have the K-laser treatment that helps. Some people can't tolerate adjustments. Some people can't tolerate decompression because they're not a candidate. Maybe they're too heavy. They weigh too much. Maybe they have osteoporosis. So we have the K-laser treatment. Just about everybody can tolerate the K-laser treatment.
Right.
So we have a variety of ways that we can treat lower back and leg pain. And the thing that I love the most about it is there's no drugs, there's no surgery involved in any of these things. They're natural, effective ways to reduce pain and heal patients.
That's amazing. I learn so much from you every time we come do one of these segments.
Thank you, Jim.
If you are having some issues with the lower back, all of shooting down to your leg, maybe you've got an issue with one of these discs that are bulging that you need to get some relief from, you need to call Dr. Spencer's office. They're located here on Pass Road in Gulfport, across from Pass Road Elementary. Set up an appointment and come find out if you're a candidate for the decompression. Certainly some of the other great treatments that they do have here at Spencer Chiropractic and Wellness, located right off of Pass Road in Gulfport.